To the first of the partnership's public policy issue forums in 2021. I'm Andrea Woodard. I'm Senior Vice President of Government Relations and Public Policy, if I could get that out. It's not even Monday. Want to welcome you all and thank you for joining us. I'm going to talk just a little bit about our public policy issue forum series and have a couple of slides before we kick off the panel conversation on childcare. So our public policy issue forum series, we've done these series in the past and really want to take the opportunity to highlight priority areas of the partnership, issues that are important to our members and investors, and provide sort of a high-level overview. We're always spending a lot of time talking with the experts, the advocates who work in that issue area, but we want to provide an educational opportunity that attracts a broad audience so that more people have the understanding and an education to help advocate to our elected officials. And so that's what these public policy issue forums are. We will be and before I go on, since we've got the slide up in front of us, want to just remind everyone to mute your microphone and go ahead and pull open the chat window, because that's where we'll be asking you to submit your questions for the panel. And so, Ryan, if you want to go to the next slide. So we will be hosting 6 issue forums throughout 2021 and sticking with a consistent third Tuesday of the month at noon. You will note the December one is a little earlier, so we're not getting too close to the holidays. But these are the dates that you can keep an eye on for the rest of the year. We'll be talking about broadband in April, and the other issues we will determine as we get closer, wanting to make sure that we're highlighting topics of relevance at that time. And next slide, please, Ryan. The partnership has for a long time been involved with the Drake University Ray Center Show Some Respect campaign. And we do this for our candidate forums, and we think it's important to always talk about civility, even though we think Iowans do a pretty good job of this. It never hurts to share a reminder. And so I just want to take this moment to remind all of us that it's important to be courteous as we're expressing our opinions about issues, and to have civil, thoughtful dialogue as we move forward in today's conversation. I have no doubt that will be the case today, but again, just want to mention our civility pledge here. And so with that, I am going to introduce our event moderator, who is going to talk a little bit about what brought us here today. And as you can see on the screen, childcare is a priority of the partnership, and this is specifically the language we have in our state public policy agenda for 2021. But Dave Stone, who's with the United Way, is going to guide us through this conversation. And then once we have the panel, we'll answer a few prepared questions. We will, as I said earlier, open it up in the chat function, and then we'll just have a couple of comments to wrap up at the end of the hour. But so Dave Stone, Advocacy Officer for the United Way of Central Iowa, will be serving as our moderator. Dave is in this role. He focuses on government relations, advocacy, and advancing the collective legislative goals of the United Way and its coalition partners in the areas of education, income, health, and essential needs. And with that, I'd like to turn it over to Dave, who will introduce our panelists for the event today. Take it away, Dave. Thank you.
Well, thank you, Andrea, and good afternoon, everyone. My name is Dave Stone, and welcome to this panel discussion on a very important policy issue, childcare. I would like to welcome our fellow panelists. Claudia Garcia Brown is board president with Conmigo Early Education Center. Claudia is employed at Wells Fargo in downtown Des Moines, and with her husband Christopher became part of the Conmigo family while enrolling their son Byron into Conmigo's Zebra class, where he was able to improve his Spanish and develop a true love of reading. Claudia was elected president of Hispanic Educational Resources in June of 2019. Also joining us today is Lora Patton, Regional Director of Child Care Resource and Referral of Iowa. Her current work is with Child Care Resource and Referral Partners and the Department of Human Services and local communities to raise awareness and educate on childcare needs. They are available to support all legally operating childcare programs through basic startup, through raising quality with training, resources, and partnerships. So I'd like to welcome our panel today. And we did, as mentioned, we've prepared several questions. And we will share those around, bounce those around the panel. And then we will open up to the audience. If you have a question for any of us here on the panel, please put that into the chat box. So I'm just going to go ahead and start out right away. I'd like to give our two panelists an opportunity to maybe make a few opening remarks about your involvement in addressing affordability and accessibility of childcare in Iowa. And as you provide those comments, can you also answer the questions, what do you think the biggest challenge you face in your industry is regarding childcare? So I'll start with Claudia.
Good afternoon. Thank you for having me today. A little bit about why I serve at Conmigo Early Education Center and their board. They provide a very needed service to the community, especially to the low-income community. We currently are licensed to serve about 140 children. That is including our summer program. A standard school year, we would probably keep it to 90 children. With COVID, we're only serving about 70 children right now. Most of the families we serve are essential workers, either in the financial industry working downtown, or they work in the food industry. So we've kept our doors open through most of the pandemic. And one of the biggest challenges that we have right now is the low reimbursement rate that we have when we partner with the state of Iowa to accept childcare assistance. So it is a very big juggling act of keeping daycare affordable, but also keeping it high quality. And that's what we're aiming for. Not just inexpensive childcare, but early education for the child we're caring for. So.
Thank you, Claudia. Lora?
Sorry about that. Thank you for inviting me to join today. Our childcare resource and referrals role in childcare is, we are just what our name says, a definite resource for childcare providers getting started, trying to expand, trying to raise their quality. Just about any topic is on the table. Phone calls for when they have children with behaviors in the program and just need some guidance or to figure out how to set up their environments in the programs as well. So we are one of 5 agencies across the state. Orchard Place houses the Central Iowa office. And so we work in partnership with Orchard Place as well. I think Claudia mentioned the reimbursement rate. That is a challenge for everybody. The other piece is recruiting and sustaining the childcare workforce. So it all goes hand in hand. It's a big circle, but we work with childcare centers who say, I have openings, I have no staff. And oftentimes teachers in childcare programs are getting paid minimum wage with little or no benefits. And that's what the childcare program can make work. But obviously it's not a sustainable career for people to go into if they can't make a livable wage. So, one of the hopes for many partners in the childcare industry is continuing to educate the need of childcare workers and partnering together to figure out that, childcare assistance, the reimbursement rate, how employers can help, if there's shared services, shared resources that can be given to childcare programs, benefits to employees of employers to help with the childcare fees, and so that, again, that can pass down so we can raise that workforce. It really is one of the biggest challenges. We also, just because I don't want to let us forget, childcare homes or child development homes serve a number of families needing childcare. And for many families, that feels like the right choice to take their children to someone else's home to be cared for. And so we work with those programs as well. And Iowa has all different categories of, you can have 5 children and not be registered and have no regulation for your program, up to you could have 16 children with a second employee in your program. So Iowa does have a lot of options, and families need options, but we also need to make sure it's quality and safe. So.
Well, thank you. And United Way identified approximately a decade ago that childcare was a critical issue to support our families. It really is a true supply and demand side problem. As Lora and Claudia mentioned, there is the supply side when it comes to the workforce and those low reimbursement rates. On the demand side, there are oftentimes childcare deserts across our state where maybe there isn't availability of slots, but also the cost. Our research at United Way shows that childcare is the largest expense for the typical Iowa family's budget, an average of $1,035 a month. That outpaces housing by about 40%, which is what we would all typically think rent or mortgage would be the highest expense. But really for young families with kiddos, it is childcare. So with that in mind and a few of the issues that we kind of identified as some of the problems here in childcare, I would like to turn back to Claudia. Is there any legislation at the state level that you are currently monitoring that you believe will improve childcare in Iowa? Do you think there are ways to improve that legislation? We mentioned reimbursement rates on the childcare assistance programs.
Yes. So actually last Wednesday, the 10th, it was kind of like childcare day at the House. There were 6 bills that were passed, all with a great majority that have to deal with childcare. But when you start digging in, they have a mixed result. One that I'm very excited about, but that could definitely be improved, is House File 292, which basically it increases the reimbursement rate as we were talking. Unfortunately, an amendment that was made to it where it was recommending a 75% increase to the market rate instead of the 50 increase rate did not pass. So what this bill is doing is to say every year, make sure that the reimbursement rate is at least 50% of the market rate. Which it would be better than right now. We're not looking at last year's, we're about looking at 4 years ago, what that market rate was. So it is an improvement and I am excited to see that. Definitely could be improved if the reimbursement rate was, a little bit higher than that. Another one that I'm really kind of glad to see is House File 302. That one it has to do with what we call the cliff effect, which basically a family is receiving child care assistance benefits. They may receive a very a small salary increase, maybe $1 an hour, maybe 25 cents, but they would completely lose their child care assistance because they would move out of the bracket. So this bill creates a more gradual approach where people would kind of be at the 225 before they start falling, before they get cut off. And that would mean that they would get a higher copay as their salary increases and not just a complete cutoff. And again, that's House File 302. So a very good bill. The only thing that I would have liked to see in there is that right now, you have to be at 145% of the poverty rate to qualify for the program. Given Des Moines, given the cost of life in the metro, 145 is really not that high. So I would have liked to see that number move a little bit higher, maybe to 175. And I think that would have created a lot more traction. Especially helping the employees that work in the small businesses, right? Where they may be, the assistant manager, but they're not making $60,000 a year. And, I won't bore you with all the numbers for like what the 45% looks like for poverty rates. You can just, we all can Google that pretty easily. But that's one that I would give it like a B, if I was grading it. It's a good bill, but it could be better. One that it's dear to my heart is the Teach and the Wages program. At Conmigo, we have several of our staff members participate in Wages and in Teach program. We actually had 2 young ladies get their CDA, which is their certificate for childcare through community college. They obtained that in May. And we have 2 members of our staff that are pursuing their associate's degree. One of them will move on to get her bachelor's degree. And that is through the Teach program. And what it does is that we get in an agreement with basically, the state of Iowa program where we say, We will give our employee release time, paid time for them to study for their classes, 48 hours per semester. They will take these classes. The program pays their tuition. And when they're done with their contract, they would either receive a bonus or a 4% salary increase. So that's kind of how we're moving forward and how we're working with that retention component that Lora mentioned earlier, and how we're making sure that even though the wage is still low, that we keep gradually increasing. And then the children in the program benefit greatly because, they're getting teachers that are keeping up with the best practices, teachers that also bring back to the rest of the employees at the center and share that work every day. So I'm very excited about that. One was House File 301. Unfortunately, it's a one-time fund. It's not something that we can count on year after year after year. So if that was made permanent, then I would give it the 8+. Then there are others that I think people that have private partnerships might speak better to them, but they're definitely worth a look. That would be tax credits. But then there was only one that I had a concern with, and that was House File 260. And that one has to do with increasing the number of children in unregulated homes. And just to give you an example, at Conmigo, our staff members have to be background checked. They have to be receive CPR training. They have to be a mandatory reporter training. They have to complete at least 12 hours of additional training per year. Most of them complete about 20 to 25 hours of additional training per year. We basically have register. We have, all our paperwork, vaccination records, all of that checked, right? And then you have people that are working from their home, and they're also a register center. They also participate. They also do their background checks. They also train on CPR. And those are wonderful, places to put your children in, because some communities need that, right? You need a smaller daycare provider that provides the care from their home. It's just the unregulated that I worry about a lot, because where we have seen issues, when you look at the news and you see something bad happen, 9 out of 10 times it would be at an unregulated home. So I'm not necessarily, I can see that it helps with the need, but I'm afraid it might also be creating a problem. So House File 260, that's the only one that I gave an F to.
Well, thank you, Claudia. That was a lot of bills. You did mention the graduated exit phase out of the state's child care assistance program. That bill was sponsored by Representative Ann Meyer of Fort Dodge in the House and Representative Jim Carlin of Sioux City in the Senate. Very much echo your comments as well, Claudia, in that we're working to really address the cliff effect with that bill, but we're still not addressing the entrance. And then you mentioned that families are barred at 145% of poverty. The typical Iowa family of 4 at 145% of poverty would be earning a gross income of about $38,600 a year. If they earned as little as $39,000, they would be ineligible for this program and would be expected to spend upwards of 1/3 of that income towards their child care expenses. So that's why the entrance of this program is just as important and critical as the exit with the cliff effect. So now I'd like to turn over to Lora. Any legislation at the state level that you've been monitoring in addition to Claudia, or any comments around what was brought up?
I appreciated Claudia's comments around the non-registered provider number increase. That is a concern. Iowa already has some of the lowest regulations for childcare in the nation. If you go to some of our neighboring states like Minnesota, there's much more regulation in place for safety for children. And so to try to have a solution be to provide more spaces in an unregulated environment, to me, is a little bit scary, because that is increasing numbers. And any of you who think about, if you have children and they have friends over, and it's a lot going on. And so when you increase those numbers, safety becomes a concern. I would like to see that change to, if they wanted to increase numbers, do it with the child development homes that are regulated, that currently can have 8 children. They are monitored. There's requirements in place for the provider and for the environment that the provider has in their home. And looking at those kids, 3 to 12 who come in, don't add more infants, because we know infants takes more one-on-one specialized care, but look at those 3-year-olds to school agers and possibly increase 1 there instead of trying to have the solution be with the unregulated providers. So I was glad that she pointed that out. The child care assistance reimbursement rates also are that just needs to continue to grow. We're paying at rates from, I think, Claudia, you said 4 years ago. I think that is correct. And, many of us, obviously the pandemic year is not the year to pick from, but from other years, our employers provide raises for our workforce. And this is a workforce that doesn't often see that. So we need to continue to advocate there. And then I think also the tax credit that she briefly mentioned for employers who supply childcare benefits to their employees, it is one great step in the right direction, because oftentimes we hear from employers like, I have people quit because they don't have childcare, and it takes me 3 months to rehire, and the amount of money I'm putting into that rehire could be put into a childcare benefit to help that employee find what they need so that they can get to work. And I think the other piece of that is when they put that money into that is, again, making sure that it's a quality environment that the money is going to, because people can't come to work if they're worried about their kids. That's, I think the average is you miss 2 weeks of work a year because of a child care situation. And again, that money up front from employers to partner around that probably could save a lot in the long run. So I think that's definitely one to continue to watch.
Well, thank you, Lora. One of our panelists just joined us, actually. Mindyvanabash is the Managing Director for Vermeer Corporation. She is the Managing Director of the Forage segment at Vermeer, a global industrial and agricultural equipment company making a real impact in a progressing world. Mindy is one of the 2 third-generation family members involved in the business, started by her grandfather and company founder, Gary Vermeer. She also led the vision for the Yellow Iron Academy program at Vermeer Corporation. And so I just wanted to provide Mindy just a moment here to provide a little bit of an opening statement around childcare and her involvement.
Yeah, thank you. I'm so sorry I'm late to the panel, but so I'm Mindyvanabash, work at Vermeer. And yeah, we had about the same, as I caught in the last little bit of this, we had the same type of issue probably about 9-10 years ago, where employees were saying they couldn't make it to work on time. We start our operations about 5:45 a.m. And so a major issue for workforce to find childcare at that time of the morning, especially with 2 working parents. And so we just did a lot of research and figured out finally at the end that we just needed to have a childcare center on site. So we have it on site. We have about 140 kids. Of course, right now we have about 100 with all the restrictions around childcare and how many kids in a classroom. But yeah, it's been a huge benefit. It's been a recruiting tool. And then, yeah, of course, in the last year, it's been tough. We subsidize it as a company, although it is open to the public, but our employees have the priority, I guess, on the wait list. Children of Vermeer employees are top of the list. And then, of course, basically all the infants now coming into the center are of our Vermeer employees. So, but something that we've subsidized for the whole 7 years we've been open. And, not only is it a benefit for our employees, but a benefit for the community in general. Marion County did a study not too long ago that we had over 900 open spaces or open children who, if there could be childcare, their parent could work. So kind of a huge issue of having our workforce fully available to work. So feel free to ask any questions. I don't know if I missed anything from other introductions, but we're open to any questions.
Well, Mindy, I'll actually just stay with you. And if you could discuss quickly how the public-private partnership started, the Yellow Iron Academy, sort of the impetus of that, and if there were any challenges in starting that public-private partnership. So I'll leave with you.
Yeah, I think we knew it was something that we wanted to be kind of in charge of, in a sense. We don't run it, we don't manage it. We also realized it wasn't our expertise, so we didn't want to staff it and have to manage the center. So worked with a third party to do all of that for us. But knowing that we still wanted it to have quite a bit of a Vermeer emphasis on it, from Yellow Iron is actually what we call our machinery. So the Yellow Iron Academy still gets parents proud of having their children there. And then really at the end of the day, we wanted it to be an impact for the whole community. So again, our team members do get a slight discount for being a Vermeer employee, but knowing that we just had needs across the whole community. And really now as we look, if we start getting more priority, more of our employees will be getting their kids in. Right now it's about 65% Vermeer and 35% community. So, still primarily Vermeer. But yeah, I think at the end of the day, we just knew there was a need in the community, and we didn't want to lose employees because of that issue.
Absolutely. Thank you. I'm gonna turn back to Lora about that, because Child Care Resource and Referral does help with startup childcare providers and childcare businesses or public-private partnerships around this. And so Lora, I'll put it to you, and then I'll also put the same question to the rest of our panel. What is the biggest challenge childcare programs face in those beginning stages in the startup?
Yeah. Well, I think like with any business starting, cash flow is a huge issue. And in our role, we help both child development homes get started as well as centers. So over the last couple of years, we've implemented a childcare ready program where we're helping folks who want to start a childcare business in their home get the basics started. There's an application process, the details of what their environment has to include, the training, and all of those pieces that we've worked with many early childhood Iowa programs across the state to offer some incentives, some cash incentives to help with that, or stipends. And that's been successful. We've seen people engage, and now that we've done a lot of things virtually this year, we cover 21 counties, and we're able to have people from all over our counties join that to help them get started. So that's been going well, and we hope to continue that. For a childcare center, again, one of the things we really start with is making sure what the need is in the community. So people come and they have aspirations. I want to help with childcare. I want to get it going. But what does that community need? Is it infant care? Is it preschool? Is it busing to and from school age situations? So really understanding that as you get started in creating your space. And then having help with navigating building codes and requirements. So that's before you even get to the licensing of DHS. You have to meet with fire marshals. You have to meet with inspectors around the building code to make sure you have all those pieces in place. And so the other piece of that, in all fairness, is the consistency across the state, with one fire marshal will infer things one way and one does it another way. So really we try to help navigate that so that programs are meeting the requirements as they get going. So definitely those are challenges for them. And then taking that next step with getting the childcare environment space ready. So again, the cash flow of ordering all the supplies and making sure you have all the pieces that you need is a lot of work, but we are able to help with what those environments need to have. And we do partner to try to help give suggestions around places to go for some funding. But those, like with any business, the funding is going to be the number one thing.
You mentioned some of the aspects that have to be started up. Training for staff, CPR, safety issues. There's a lot of things that some businesses wouldn't have to consider. Anything to speak to there, Claudia, Lora, Mindy?
Yeah. I know people look at that and say, whew, that seems like a lot of stuff. And it is. It certainly, you have to have a plan in place. There are lots of partners across the state who will help with accessing the CPR and first aid, or the essentials training is some basic training that employees have to get started. But those pieces are to help you get off on the right foot. You don't want to have people join childcare. A lot of times people say, oh, childcare, it's an entry-level job. I'll just go in and hang out with some kids. And then you're in this environment where you have many children and you are trying to keep them flowing together in a positive way. And so you need some training behind you to also help keep them safe. So just working together with us and with other partners, IAEYC, as well as Iowa State Extension, all of us will help get those pieces in place to help with that regulation part of getting started.
Okay, thank you. For the panel, Mindy, Claudia, Lora, are there any unique childcare delivery options that you believe Iowa and the Iowa business community should explore in terms of being able to provide for this necessary need of childcare? I'll open up to anybody.
We are a standard 5:30 a.m. 6:30 a.m. to 5:30 p.m. Monday through Friday childcare center. Every once in a while, we get people asking for extended care, the weekends or second shift, and I believe, and that is where it's very, very hard to find in a center setting. So those are the children that are going to end up, hopefully, in a regulated home with a daycare provider that has done all the CPR and training and background checks. But that is a specific need that I think it's still not being met. And then also children that may have minor special needs. For example, my son has a peanut allergy. So we have to be very, very careful on where we put him in daycare. For us, it was very important that every staff member was trained in the use of epinephrine and CPR and things like that. So I think that those are the needs that are still kind of people in Iowa need help with.
Lora, Mindy, any unique delivery options for childcare that you see on the horizon?
Yeah, I mean, for us, I think that was part of our decision making of going with a third party. So again, even all the regulations, we knew nothing about that. It's not something that we had the knowledge of or the, I guess, expertise to look into. So that's where we kind of found the third party was the best. They knew regulations, even from the previous question on code and training and finding the people. I think the biggest thing still in Iowa, whether it's Vermeer as a company or the childcare center, is we just can't find the labor. So I don't know how we magically get more people into the state of Iowa, but definitely this concern of just labor shortages, especially in rural Iowa, I think we've got a major problem with that.
I would agree with Mindy. I think it's continuing to make childcare a field people want to go into, not just the people bringing people to Iowa, but then making it an attractive career to get people into. And it often is forgot about, I think, until an employer says, my people aren't coming to work, so I've got to figure out help. I think there's community solutions. I think people coming together as a community and figuring out what the need is. And then, you bring people together who have different backgrounds, and all of a sudden you have somebody that can figure out funding and can figure out how to help with the building codes. So those community coalitions that are popping up here and there, I think that is one of our best avenues right now. The metro area is a little harder with that, just because we're so broad, but it could be done. And definitely in our rural areas, we're seeing it happen more and more.
Yeah, just the result of that Marion County study was kind of what you're talking about. Is we'd really tried to come together. We kind of had our center, but we were willing to continue to collaborate with other businesses of 3 or 4 of them all came together and said, how do we come together with maybe the public schools and talk through, I think at the time, the biggest issue was after school care, before and after school care. But then we have a huge shortage in infant care. So how do you kind of separate that up? And are there a couple of businesses who would work together just to make that happen from a funding perspective? And you get the community schools involved, and they've got understanding of building code and that sort of thing. So we haven't gone anywhere with that yet, but definitely still, ideas in some rural areas.
And Mindy, you make a great point about involving the school district. I think that's, one of the pieces that we have heard in different areas where a school building may be sitting empty, and all of a sudden it can be a space for childcare or a lead-in at least. So I see in the chat, and I'll just share because it was on my list, and from the Iowa Women's Foundation, as mentioned, they've done a lot of work around childcare solutions and are willing to work with communities and help bring people together. So she has given Dawn's contact information, but she has really helped spearhead some of the work across the state to help find some of these solutions. So been a huge partner.
Excellent. Well, thank you. I would like to invite all participants, if you would like to pose a question to one of our panelists, start putting those in the chat right now. We have a few already there that we'll try to address. But back to my panel here, in your opinion, is there a best approach to childcare of the options we've discussed today? Is there anything that's a challenge to increase the childcare access right now?
I don't think there's there's not one fit for every community. I think it really does have to be community driven. So those conversations need to happen. And I do think we're hearing that people are coming together. We're getting invited to the table to talk about those more and more now. So I think it is, it's not getting shoved under the rug anymore. It's definitely out there for people to talk about. But I think, that push of just people coming together with what can they do. I think sometimes we come in with, we can't do that, but what can we do? What could I offer as an employer or as a community member to help get this going? I think those are really the best next steps.
Claudia?
I agree. I think that, I'm talking from a daycare center perspective, but most of us really are focusing on what is best for the child. So at Conmigo, we are focusing on bilingual children whose primary language may be Spanish, and we want them to be proud of their history, so we continue with that. So for us, it's twice as hard because we're not just looking for staff, but we're looking for bilingual staff. We've made our minimum wage at Conmigo $9.25. That's the minimum wage. We don't pay $7.25. We do offer vacation. We offer holiday pays. We offer benefits, and we still have a hard time, paying them more because we also participate in the child care assistance program. But to give you an example, today at Conmigo, we're charging private pay, which that means it's somebody that pays completely out of pocket, $208 a week for infant care. 9 years ago, in a private daycare center, I paid $211. And it was a partnership with my employer. So with one infant, I paid $11,000 a year in childcare. So that is the cost. Today at Conmigo, families are paying $7,000, if they have to pay out of pocket. But then how do we make the gap to pay our staff what they deserve? Because you have to understand that it's not babysitting, it's early education. The staff is focused on the emotional development of the child, on the social development of the child, on the academic achievement of the child. So they need the background, they need the information, they need the preparation, and they are early education professionals. They are not babysitters, and they deserve a living wage.
Thank you, Claudia.
Yeah.
Mindy?
Yep, I'll jump on that too. So I agree. I think, every community, every company, every, group needs to figure out kind of what's the best fit for them. But yeah, I would say one of our biggest issues is also the pay. So, because Vermeer subsidizes, we've made the decision to offer a higher wage because we've got such a tight labor market. We had people leaving the childcare center who were early education, educated people to go to Walmart, and that was hard. And so we ended up going back and looking at how much we're paying, and we ended up raising it. Especially during the pandemic, we gave also another raise just because we wanted to make sure we could keep them, because we knew the importance that they were to the community or to the center. And to the point, yeah, our kids focus every day on STEM. So being a manufacturing company, we get excited about that. So they're learning math skills, and we even have our engineers from Vermeer go over there during engineering week and do some fun activities with the kids. So it's really kind of, I agree, it's not daycare. And what we had a trouble in the beginning was Pella has a lot of in-home where the pay was a fourth, or the charge was a fourth of what we were asking them to pay at the center. And so we couldn't compete. Now, when they finally started getting them in the door and they realized it wasn't the same situation, there was curriculum and structure and a lot of that stuff. Not to say that all in-homes don't have that, but what we were fighting with, I guess, or competing with from a childcare perspective was more of that situation. Once you started understanding, where these kids were at then when they were going off to preschool and kindergarten, parents were starting to understand, the value more of what it was costing them. But I agree. I mean, you can't just raise tuition all the time to offset what the teachers need to be paid. And so I think there is a tough situation there of how do we make sure we can create a career path for the teachers as well as still make it affordable for the parent. And so I think that's where we're kind of all sitting, where, you can't just, that gap's going to keep growing as you raise them, right? So I think that's one of the biggest issues probably that needs to be looked at from a state level.
Well, thank you all. I'm going to start taking some questions from the audience. And one thing that Mindy kind of tacked on here was, the childcare environment in Iowa was strained prior to COVID-19. A question to the panelists: what has the pandemic done to childcare, and what does that mean for moving forward?
I can speak for Conmigo. We, as board members, made a decision that we would keep all the staff that we could keep regardless of enrollment. So we dug into our, reserves, and we maintained our staff levels. We still had some attrition. Some people decided that it was not the right thing for them to be in childcare at that time. We have all the guidelines in place. But for example, our laundry costs, because there's a guideline where we have to launder bed sheets every day instead of like the once a week or sending them home. We spend $5,600 more a year just on staff hours to do additional laundry. Of course, we don't pass that on. We don't raise tuition to meet that. Luckily, there were grants and stipends and things that we've applied for that. But the challenge is that some of those guidelines that are in place probably should stay in place. So that means that the cost of daycare will be permanently increased, the cost of providing the daycare. So how do we meet that gap? And for us, the difference has been the smaller classes. We definitely see children do better in those smaller ratios, but they're not sustainable long term.
Lora, any comments there from CCR&R, what you guys are seeing in terms of pandemic impacts?
Yeah, I think certainly, as Claudia mentioned, the new regulations that came with keeping childcare programs open were taxing on programs and took giving a financial hit for some of that. So I do think, to her point, some of the regulations really have been good. I mean, they've been some safety pieces. The smaller groups are helpful in some situations, both for just managing and navigating a classroom full of 4-year-olds more easily when there's fewer of them. Now, again, we go to the financial stability of that probably is not there at this point. But I think we've seen childcare providers do new things and learn new things that they'll take with them as they continue forward. And so I think that's been definitely a positive. And certainly, I think we've seen communities come together to support through all of this. The Department of Human Services was very willing, like, tell us what people need, and partnered with different agencies to get things out to childcare programs. I mean, we were delivering hand sanitizer and bleach across the state at the beginning of all this. And that was, it was good to be able to see our statewide agencies step up and be able to help with all those things as well.
Mindy, any other pandemic impacts for you?
Yeah, I mean, I think the labor piece, when it's already tough to find people, we had to actually hire more people to give breaks. So our center is affiliated with Bright Horizons, and they had even maybe more restrictions than the state of Iowa did because they're headquartered on the coast, and there was just a lot more restrictions placed on some of those states. And so we were hiring people to give breaks, and then those people giving breaks had to stay in the rooms they were giving breaks to not be being in a lot of different classrooms. And then another thing, we always do family style meals for the 2 meals a day at the center. And, that added a lot of cost. We can't be passing bowls around anymore and serving each other. So the cost went up quite a bit. I think the other hard part too is, we usually let the parents walk the child to the classroom. New restrictions, they dropped them off at the door. So, I guess in my mind, most of the restrictions we've seen, I hope get reversed, that we can have that more of that community of the teacher and the parent, and have the kids, having more time around a table, learning some of those table manners and that sort of thing. So, at the end of the day, I think it's just, unfortunately, a lot of extra cost that's been incurred by all centers. But I think, the don't send your kid with a cold or fever or, some of those things, I think are things that maybe parents didn't think about as much in the past. And I think we'll all be more diligent about that in the future. So at the end of the day, we've all made it through. It has been trying, but continue to keep moving forward and hopefully see some of these restrictions let up, although, understanding we can't be going too quick, too fast.
Question from the audience. I think I might direct this to Lora. Are there any public resources for people looking for childcare to find out if they are regulated or any other information on their provider?
Yes. So Claudia actually put the link in the chat box. So thanks for doing that, to our website, iowaccrr.org, and then /families. There you can receive a list of regulated programs. You can also always go to the DHS website under families services, and then childcare's there, and you can research programs there as well. So those are 2 great places to go. We also have a childcare resource line that is, someone will answer the phone and talk through with you if somebody is looking for childcare. All those things, like I need somebody that takes CCA or an infant or whatever, and we have specialists who can help with that.
Question from the audience. We've seen a drastic decrease in the number of registered providers in the past few years. Is that the reason behind House File 260, the bill that would increase the number of children in a provider's care? Is it targeted at trying to increase the number of registered providers in the state?
I think it is the goal is to try to increase the number of childcare slots available. I don't know, certainly I think everybody's trying to figure out how to increase slots, and there has been a huge decrease over the last 5 years across the state. So I think it is trying to look at that and figure out ways to do that. Again, looking, as I mentioned earlier, I think looking at those regulated programs where there is quality assurances in place would be the space to make a difference versus not regulated. I'm not really sure why I understand why it's been presented for the not regulated programs instead.
Anyone else from the panel on that one? Okay. One participant asks, are there any regulations for a business paying a registered provider as opposed to establishing their own center? Would there be any regulations against that?
So I saw that one. I don't think there's any regulations saying they can't, but another way to maybe look at that is to offer an employee benefit. We've seen in some communities where a business tried to bring together a cohort of centers to say, here's centers who are available and will prioritize your child because you're employed here. And then the employer was working to try to give the childcare provider a stipend sort of thing. I think it worked at some point. It became a little bit complicated. So I don't think there's anything in regulation saying you can't do that. But another way just to look at that is to go from the employee benefit standpoint instead.
And legislation is currently moving through the House and the Senate that would expand a business tax credit for employers who do provide childcare benefits. And so that is a potentially new tax credit that may be made available if it makes its way through the legislative session. A couple more questions for you, and then we'll turn it back over to Andrea. Is there anything specific that chambers of commerce can do in the childcare realm here across the state? What is the role of chambers of commerce and business in helping to address childcare? I'll put that to anyone on the panel.
I think people have mentioned, but I love data. That's my day job. I'm a data analyst at Wells Fargo. So 75% of the families in the metro are dual income families, right? And we already talked a lot about a shortage of labor. So if you want, there's studies that say people that don't have to worry about daycare are more productive, are more relaxed at work. They basically are your star performers. So what you can do is maybe look into those partnerships like Vermeer did, or maybe there might be a local, daycare center that you can sponsor. And it's really easy for us as a non-for-profit daycare to get funds for specific programs. So like if we wanted to let's say, improve our playground, we probably could get somebody that would fund that program. But just simply running of the day-to-day center, that is very, very hard to find. But I think that as a Chamber of Commerce, what you can do is simply just talk to your legislature and support some of these things. Like, for example, say, hey, I heard about the cliff effect, but why is it 145? Why can it not be 175? And then talk about, this is the wages that I pay my employees. This is where my employees are at. This is how you can help me be a better, employer, because then I'm also have happier employees. So that's one that you can help with. And then also competitive, right? If you're gonna go ahead and hire out and bring people into Iowa, people are gonna look at not just the salary they're gonna make, but the quality of life. Is like, is my child gonna be able to have strong public schools, strong daycares? Am I gonna be able to do those things? So that's what the Chamber of Commerce can do, in my opinion. Thank you.
Yeah, that's kind of the last statement is what our chamber has done also is as we try to attract people into the Pella community to the companies here, they do a really good job of showing potential residents and or employees around to the center. We actually have 2 centers in town, so the 2 centers in town, and talk through those type of things. So it's really more of just a recruitment tool, I guess. And then, yeah, we've had them post positions when we're looking for people who, childcare providers or, member or the employees of the center. They've helped us a little bit with getting the word out and making sure that we're tapping all the resources from finding employees. So, but yeah, really, and, at the city level, just when we went to, we had to do some, some changes in coding and that sort of thing. But I mean, that was more kind of working with the city of Pella.
Excellent. Well, Lora, any quick comments?
No, I think what Claudia and Mindy both said are great from the chamber's support. And often in communities, what I've experienced is chambers are great at bringing people together. So having agendas that include childcare and educating people. I think sometimes folks don't always know what the childcare situation in their community might be. So it's a good opportunity to talk about that and talk about what quality childcare is as well.
Well, that is all the time we have today for questions. I'd love to thank Claudia, Lora, and Mindy for joining us on our panel today, for their time and their expertise on this really dense and really interesting issue that has been affecting our state for such a long time. So I'll just turn it back over to Andrea for some wrap up. Thank you all.
Thank you, Dave. Truly, thank you to Dave, to our panelists. If you have your reactions at the bottom of your screen and can join me in giving them a round of applause, really appreciate their expertise and their time. Ryan's going to go to the next slide. You know, these are opportunities for us to not only educate ourselves, but then take that next step and advocate. And it's been said by a handful of the panelists, but contact your state senator, your state representative. And you know, you don't have to know all the details. You don't have to know the bill number. You don't have to know some of the data. Just by sharing your story and your experience with the issue of childcare goes a long way. Now, if you want the information, you've got a great list of experts who were with us today. Please feel free to reach out to any of us. And if you contact Ryan or I, we can make sure to get you in contact with any of our panelists today. We will send out an email with some information that hopefully will give you all an opportunity to be that advocate to help us further our goals to provide affordable and accessible childcare, not just in our region, but beyond. And also, I know there's been a couple of mention of different organizations, Iowa Women's Foundation, Save the Children. If we'll include some of that information in a follow-up email so that you can engage, get involved with the issue to help us out. So with that, as I mentioned earlier in the event, we have our next forum planned for April 20th at noon. We will be covering broadband, and we'll just look forward to hopefully seeing you then and communicating in the meantime about how we can be good advocates for childcare. Thank you, and everyone have a great afternoon.